Today I am talking about trauma and happiness with Dr. Aimie Apigian from California, USA. Hello, Dr. Aimie.
Hello, hello.
How are you doing today?
I'm well. I'm happy to be here. Thank you.
Same here. Thank you so much for joining us. Let's start by finding out a little bit about you. Who are you and how was your journey in life so far?
Wow. Well, I am a medical physician. And so I started in conventional medicine, went to medical school at Loma Linda University, actually got a master's in biochemistry, and then a master's in public health as well. And I started residency in general surgery, did 3.5 years of that residency, and then had a big experience with my own health, found functional medicine, and really at that point also decided to create my own field of medicine, my own path in attachment, trauma, and addictions. And so I changed residencies and actually then went on to a preventive medicine residency and then started working as an addiction medicine physician in several different areas and different types of addiction medicine, but ultimately started running a 20-bed medical detox unit. And that's when I really was able to start dedicating more of my time to sharing what I have learned about trauma with people. And then in the last, my goodness, in the last 2 years, that's all I do now. And so I offer online educational experiential programs for addressing stored trauma in the body.
Wow, that sounds so interesting. Can we clarify a little bit before we move any further? What is functional medicine? I'm imagining that some of our listeners and watchers are not quite familiar with this concept.
Absolutely. So my experience was that I was in general surgery and started to have a lot of anxiety and depression that didn't bother me as much as more of the weight gain and fatigue. And for me, the fatigue got so bad that I had to take a medical leave. And there was a point where I could not get out of bed, which was very unusual for me because I had always been very active, had run 5 marathons by then, had, done several different 100-mile bike rides. And so for me to be in bed and unable to get out due to fatigue really scared me. And I went to do all the testing and stuff that I knew how to do because that's how I was trained. And we couldn't find anything that was really wrong. I was on 2 antidepressants by then to help with the anxiety and depression, assuming that we were dealing with stress and burnout. But the health problems, the physical fatigue was not getting better. And I had a lot of GI symptoms and pain and a lot of just generally feeling unwell with my stomach. And so when I could not find any answers from the medical system, then I started doing some research and found functional medicine. And functional medicine is I would say, a field of medicine that really looks at the root cause. So we're not just looking for symptoms and looking for what medication we can prescribe, but we're looking for, well, what's causing that symptom and what's causing that and what's causing that, and really getting to the root of the issues so that we can not only identify what is driving our symptoms, but then have a solution that will be lasting and not just a band-aid. So functional medicine is that kind of true root cause approach that is also tends to be more integrative and being able to look at all aspects of a person, including all of their life experiences, as a way of understanding their current health and their path forward.
That sounds so fascinating. So I absolutely love where the conversation is going. So now we know what functional medicine is. I'm also interested in finding the root cause of the problems I'm dealing with myself, with my clients and my therapy work as well. And then you arrive at the point where you choose to specialize in preventative medicine and in addiction medicine. And let's see what's this about. We seem to be having a clue, but we would love to learn from you. How is this field developing? Is this a real field? Are there many practitioners doing this, or we are just at the beginning?
We, unfortunately, sadly, we are still at the very beginning, which is surprising because we have the data, we have the knowledge that, look, there's this big connection between trauma and disease. In fact, that's the whole topic of my next summit is the trauma disease connection, to help clarify that for people. But really, the work, I would say, started to be brought forth in the 1980s. And this was with Dr. Vincent Folletti, and he started really the first adverse childhood experiences study and found this big connection between childhood trauma and women with obesity. And since then, there have been so many more studies on this connection between adverse childhood experiences and adult onset disease. And we're beginning to understand more of the mechanism. And what we have thought is just stress is not really stress. It really is the trauma response in the body and the changes that happen to our biology when the body goes into a trauma response. But despite all of this information and research and publications, the field of medicine still has not known what to do with that. And so you're not going to go to your physician and they're going to know how to have a conversation with you around trauma. They may ask you about stress. And if you tell them that you are stressed out, they'll tell you to do some stress management. They may recommend meditation, yoga, therapy, but we're still really missing the mark because those aren't the right tools to be prescribing. And actually we're misdiagnosing people and telling them that they are stressed when actually they're really dealing with a trauma response in their body. So still so much to be done in bridging the worlds of medicine and trauma work.
Indeed. In your experience now, Dr. Aimie, what's been your learning around the connection between trauma and illness, in particular mental illness, but not only, because you do specialize in addiction medicine as well, and you developed this wonderful rehab. So what's been your learning so far?
Oh my goodness, it's so deep and it's so rich, and it's been really wonderful to understand the mechanism, the science behind it, so that it's not just something that we say, oh, this person has a problem, this person is bad, this person is weak, but being able to see, wow, there's biology behind this, and we can come in and support someone's biology. So the trauma response in the body really creates a lot of downstream effects. And it is true that we can actually have biology, whether it's something that we are born with or something that we acquire along the way, but we can have biology that sets us up for having a trauma response, for being more likely to experience trauma, for almost being predisposed to trauma, if you want to use that word. And a lot of times, this is what we find in those who become addicted to anything, people, places, things, not just substances, but any form of addiction, is that they have a nervous system that's wired for trauma response, for being overwhelmed. And that is literally their way of trying to find some way to feel better. And their body, being inside their body, is so uncomfortable for them because this is their nervous system and this is the body sensations that the nervous system drives. It's so uncomfortable for them to be in their body that their coping mechanism, in order to get through their day, get through their life, somehow function to the best of their ability, is to find things outside of themselves that will help what we call bring regulation to their system. And just that sense of, okay, at least for right now, I'll be okay. Now, it is a false regulation because, of course, that's just temporary. And it actually, even for a lot of the substances, it actually induces a form of trauma response where they just kind of go numb. And so it's not that anything has changed in their life, that they're in a better place or that they feel better. They just don't feel that inner pain. They don't feel that inner anxiety, that inner restlessness that constantly drives them to seek something to feel better. But it is temporary. And so as that wears off, they start to feel their body more. And then they're looking for what other people would call their next hit or their next fix. And yet what it really is just all their internal physiology that's literally screaming at them to help them feel better. But we see this in so many other people as well. So it's not just those with an addiction, but certainly anyone with anxiety and depression. We're finding that so many of them have brain inflammation, and brain inflammation is part of the trauma response. And whether you have brain inflammation as a result of having a head injury in your past, and this can be even something from just hitting your head on something. It doesn't even mean that you had to lose consciousness or have this big traumatic brain injury. No, no, no. Like even small things, just moments of time where perhaps there was less oxygen to your brain. Perhaps this was even during your birth, where maybe you were born with the cord wrapped around your neck, or whatever circumstances that create brain inflammation, or what we call the priming event. And it just sets your brain cells, your microglial cells, these immune cells in your brain, to be more set to overreact to stress in your life. And all of a sudden you've got this brain inflammation going on. Of course, you don't know that, right? Like you don't know that it's brain inflammation, but what you start to feel is you feel the brain fog, and you start to feel that decision fatigue where everything just feels hard. You may become more sensitive to lights, to noises, to sounds, and you just want people to go away, and you start snapping at them, and you get irritable because things are taking longer and you don't feel like you have enough energy, and people are using up your time. And this is all from the brain inflammation. And yet that brain inflammation will cause the body to go into a trauma response. And when your body goes into a trauma response from other reasons, whether it's an emotional experience that you have, or whether you have an illness and you're getting sick, those are different reasons for the body going into a trauma response. It will cause brain inflammation. So brain inflammation and the trauma response go hand in hand. And a lot of that brain inflammation is very apparent and present in any of the mental health or emotional symptoms that someone experiences.
Mm. So interesting and so clear for everyone to understand, actually. So now we know what trauma is, how we're coping with trauma sometimes through all of these behaviors and dependency on substances and so on. What is the impact on us, especially on our happiness and our quality of life?
Oh, such a great question. And the more that I've leaned into understanding trauma, the more that I've seen that this is directly impacting our capacity for happiness. And so when you think of capacity, I think of like my morning cup, my morning mug, right? And it's like whether I'm pouring tea or whether I'm pouring coffee or whatever it is, right? You've got your mug. And how big is your mug? Do you have a small mug? Is that only the amount of happiness that you can hold? Or do you have a big mug? Are you one of those that ones, like a really big mug and you can hold a lot of happiness? And what happens is that when we have stored trauma in our body, and so our body is continuing to go into a trauma survival response day after day after day, our capacity, the size of our mug is very small for happiness. And so we actually can't hold a lot of happiness. We actually can't hold a lot of joy. We also can't hold a lot of stress. So whether it's something negative like stress or something positive like joy, we have a very low tolerance for that. And both of those things can overwhelm our body. And we notice that we have to pull back. We notice that we have to withdraw from situations that are too happy, that are too joyful, because we notice that afterwards we seem to have this exhaustion and we have this fatigue. And so the trauma response and our bodies our body going into that survival place really is the true root cause of our capacity and our lower capacity for happiness. It was interesting because I just finished a 6-week journey leading people through grief and gut health. And there's so many emotions that are stored in our gut. And when we have gut issues, gut inflammation, it actually stores more emotions. And one of those main emotions is grief. And I can't tell you how many people at the end of this 6-week journey told me that they didn't know that their path to happiness was through the trauma grief work. But that was what they found, is that when they dedicated themselves to working with this trauma response, helping their body come out of a trauma response, that was actually what opened themselves up more to happiness, to joy, to life. Because when the body goes into a trauma response, we close down, we shut off, we withdraw, we isolate, we guard, we brace, because we're there to protect ourselves. And so we're not able to be open, which is what we need to be in order to experience that flow and that happiness, that wholeness, that joy. And so literally happiness and joy is not possible to experience when we have an active trauma response and our body going into that trauma response every day. They are incompatible. They're different systems and they cannot coexist at the same time.
Wow. That's so well articulated. Thank you so much for this. It's beautiful indeed. We now have an understanding of the impact of trauma. What do we do about it?
What do we do about it?
Yes. How do we heal?
How do we heal?
Where do we start?
Where do we even start? It can
Yeah.
seem so big. It can seem like such an insurmountable problem that we don't even know where to start. And so we don't start. And then years go by and we start to develop even more health issues. And then eventually we're like, okay, now I have to, now I can't ignore it anymore. But it actually doesn't need to be as hard and as confusing it has been. And one of the things that I have found is that when we bring in the right elements and in the right order, the right things in the right order, we can actually do a lot of the trauma work much faster than what we've done before. And so many people who come through my 21-day journey, which is the first place where I start people, 21 days of somatic work. People going through that, they tell me, I've been in therapy for years, for decades, some of them for 30, 40 years. And yet they're experiencing more transformation in those 21 days because they're finally doing the right thing in the right order. So I teach a masterclass on this. It's the essential sequence. And we have to start with safety when it comes to trauma. And this cannot just be our brain telling us that we're safe, because our brain tells us stuff all the time, right? Our brain tells us like, oh, honey, come on, what's wrong with you? That's how our brain usually talks to us. It's not actually convincing the body that it is safe. And that's exactly what we have to do. We have to so create the sensation of safety for our body that our body feels safe, not just our brain or our mind telling us that we are safe. And we can do that. We have the tools to do that. And then when we do that, it's been so amazing because our health symptoms already starts to change. And people who go through this process, first safety, then support, and then moving into expansion, what they experience is 26% decrease in daily physical pain. So by the end of these 21 days, and all we're doing is a short 2-5-minute exercise. We do have a live group component. So I do think that safe community does play a role, but otherwise they're doing these exercises on their own time with a video recording that I give them. And they're experiencing a 26% decrease in daily physical pain. Now, if people had 26% less daily physical pain, don't you think that they'd experience more happiness in their daily life? Less pain means more happiness. More pain means less happiness. And so that's the way that we see them experiencing this, is that they're experiencing more joy. They're experiencing more connection because their physical health symptoms are decreasing, which creates the space for joy and for happiness and for connection. They experience 28% decrease in GI symptoms, 28% decrease in sleep issues just by the end of this 21 days. So the importance is to do the right things in the right order. And when we're starting trauma work, or when we're deciding that we've done a lot of other modalities that don't seem to be getting us the results that we want, we have to start with creating a felt sense of safety for our bodies. And I do that by leading them through somatic exercises. Somatic meaning I'm just going to connect you with your body. We're going to learn how to understand what your body needs and be able to shift your state. So shift your threat physiology to safety physiology. Shift your emotional state from fear to feeling safe. And just with that shift, we're seeing so much of an increase in people's happiness, along with the decrease in their physical health symptoms and pain.
So beautiful. So this is the start point. What are we doing next? How do you experience working with people, and what kind of trauma healing model you practice on a long term?
Yeah, this is true. This is just the starting place, because at that point, now the body is more ready and it's available. Before, it was just shut down. And so we really couldn't do anything. And now that the body is more ready, now we can bring in the other elements that we need to. We have to address the biology of trauma. We have to address what changes have happened on a cellular level as a result of this body of ours going into the trauma response. It has created oxidative stress. It has created inflammation. It has created changes in our neurotransmitters. We need to address those in order to help our bodies get back to a place of health and wholeness and accelerate that process so that we are not spending years working on this, but able to really accelerate that process to health and wholeness. We also do need to look at the thoughts that we have. Now, our physiology or our biology is what drives our thoughts. And so we do a bottom-up approach, meaning the more that we do of the somatic work, the more that we do of the biology work, the more that we notice that our thoughts will change. But still, over our lifetime, we've gone through experiences that we were overwhelmed with at that time. And that's the definition of trauma, is that anything that for any reason at that time overwhelmed our bodies. And when something overwhelms us, we develop what's called a part of us. And so there was a part of us that got stuck almost, and it made a decision at that point. It made a decision of, oh, I will never do this again. Oh, I will never love again. I will never trust someone again. I will never. And parts of us have made these decisions along the way. And that is an element that we also need to look at. And so the way that I do it is I integrate them. And so I take people on these journeys. I take them on a journey into attachment and neurodevelopment, changing that early programming that we have. And I integrate parts work, somatic work, and the biology work. Even in the grief and gut module, that 6-week journey, I'm integrating these 3 elements, the somatic work, the parts work, the biology work, because through that integrated approach is where we see the most transformation happen in the least amount of time.
So interesting. So it's a holistic model, your trauma healing model. Tell us a little bit about the results. What are you seeing that is happening at the end of these programs that people follow with you?
Yeah, it's been amazing to see people getting off their medications, people
Right.
who are seeing resolution of their symptoms. A lot of people are coming with autoimmunity issues or skin disorders because these are chronic expressions of the body having gone into a trauma response, and their symptoms are clearing up and resolving. Their gut is feeling so much better. Their IBS issues are resolving. They're sleeping better. And whether it's trouble falling asleep or they can't stay asleep, whatever their issues are coming in, now that their body is feeling safe, now that their biology has been shifted more to a biology of safety and not a biology of threat, it changes everything. And so everything in their physical health, their life, their relationships starts to shift, and they become amazed at who they are becoming. I remember just Isabel the other day, and she mentioned that she was going along her day, something stressful happened. And for the first time, she noticed herself pausing and then approaching the situation very different. And she's looking at this being like, who is this? Who have I become? Because it's just flowing out of me now, rather than me overreacting and getting angry or withdrawing and shutting off and isolating. It's like I'm becoming a different person, and it feels like it's just flowing from me rather than me even having to think about, okay, I need to do something different here. And what am I going to do different? It's being able to, again, kind of get out of our heads, get out of that thinking, and having been able to drop into our body and create a body that feels safe, a body that feels supported, and being able to expand our window of tolerance so that we're navigating life, relationships, decisions so differently and in a way that feels like it just flows. And we feel like it's truly who we are, rather than making messes and realizing, no, that's not what I really wanted to do. This is not who I really want to be. Truly being able to step into our best self and our best health.
Beautiful. It's the reconnection with the true self, isn't it? In a way, when we manage to go through this journey of self-discovery, of healing, and then personal growth, growing into who we really want to be, not who we thought we are. Absolutely amazing. So now I'd like to close gently the circle and move back into the functional medicine for a couple of minutes, if that's okay. To talk a little bit about your experience around intergenerational or transgenerational trauma. I'm researching this. It's part of my journey and my own healing. I'd like to hear your thoughts about this whilst working with people in the rehab, but also throughout your life and work experience. What's your view on transgenerational trauma, how prevalent it is, and how does it look like?
Well, it's very prevalent. And that's one of the elements of trauma, is that certainly any unresolved, unhealed trauma does get passed on to the generations. And there's many different ways in which this happens. The way in which I can best speak to it is actually the biology way in which it gets passed on. And I don't think that this has been well understood. And so people have tended to focus on the other areas, the other ways in which it's passed on, which is all true. It's all true. And there's also this biology component. And so we understand that stress and trauma actually creates different bookmarks on our DNA. And those bookmarks can actually be passed on to our children. And we call this epigenetics. We call this methylation. And so even the pattern of methylation on our DNA can be passed on to our children. And so those experiences that we have had that have been overwhelming are getting passed on through our DNA, not like the actual DNA itself, but these bookmarks on the DNA that guide how our DNA is expressed, and so can change aspects of our physical health, like our neurotransmitters. And what we've noticed is that more of society is shifting towards an undermethylation status, which means that globally, the DNA has less of these methyl bookmarks, and that's changing our neurotransmitters. That's changing even our anxiety levels, our depression levels. People are becoming more fear-based and driven and competitive and pushing themselves. And this is one of those ways in which generational trauma is passed on. The other way is through oxidative stress. And so we know that one of the downstream effects of generational trauma, or trauma, is the buildup of oxidative stress, not only around our cells, but inside of our cells. And again, even around our DNA, causing damage to our DNA. That's why we can age faster, but that's also how it can be passed on to our offspring and our children. And so cannot stress the importance of parents, and especially moms who carry their babies, for them to do trauma work, for them to look at, where am I still carrying fear? Where am I still carrying overwhelm? That I can address this, because my physiology, my biology is what I pass on to my children. And in that biology can be these patterns of trauma already.
So beautiful. That's absolutely amazing. I'd like now to come closer to you and ask you what inspired you to feel interested in trauma healing and being of service to others and wanting to help others.
Yeah, so that's a great question. And I would say that my interest in trauma really started when I adopted Miguel from the foster care system when I was in medical school. And I first signed up to be a foster parent. And it was just at the end of getting my master's in biochemistry, and I hadn't quite yet jumped back into third year of medical school, and had always kind of felt led to help children who were under a lot of stress. And so I decided to be a foster parent, and he was the first one that they placed with me. And he had had such a rough history before coming to me that he already had, by age 4, he already had very severe emotional and behavioral issues. And he was not being successful in other homes. He was not being successful in homes that had other children, pets, anything. And so they placed him with me. And then they're telling me, the kind of like what his trajectory would be if they're not able to find a permanent placement for him. And that really is what prompted me to make that commitment to him and say, all right, yes, I will be your forever mom. I will adopt you. And part of that commitment for me was I am going to try to figure out what it is that you need for you to be happy. Because I could tell that he was so much in survival mode, so reacting to everything, especially love. Love for him was not a safe thing. And I knew that he needed to feel my love in order to be happy. And I wanted him to have some happiness in his childhood. And so I threw myself into figuring out what he needed. And in the process, started learning about attachment and attachment trauma and then trauma. And it was a very long process. And I went into it with this expectation that my love would be enough and my love would be what he needed to heal. And having to learn that no, like for him, love was actually what scared him the most because he had never had that experience. And that openness, that connection, that vulnerability was the scariest thing for him. So his deepest desire was for connection and love. And yet that was also his greatest fear. And that's how I got to learn all about this stuff. And then, of course, then later on, when I had my own health experience and I realized, being the medical physician, I knew from my studies that all of the health symptoms that I was having were related to adverse childhood experiences. Then I realized that, hey, even though I am one that I don't look back at my childhood and see trauma, that something's going on because I have the same body. I have the same health outcomes as someone who did have a lot of trauma in their childhood. So I am missing something and I need to better understand this and even understand, is it possible as an adult to rewire these patterns of survival and trauma in my body?
Wow, this is very, very interesting. And you've been through your journey now. You had such an empowering story with Miguel. It's a success story, obviously. So what is happiness to you now? What are you learning through all of these experiences?
What is happiness? What have I learned? Happiness is being able to show up and bring value and have value in just being, not just doing, and being able to wake up every day having purpose, having meaning, and above all, being happy and loving yourself.
Mm-hmm. Beautiful. And now towards the end, I'd like to ask, what are your best 3 teachings? What have you learned that is worth sharing with others? In addition to everything else, that all the wisdom that you shared with us today, how can we live a happy, meaningful, and fulfilling life?
Yeah. How can we live a happy and meaningful life? The first one that I would say is, even if you don't think that you have trauma, do trauma work. And I would start with somatic work. And if you need a journey, if you need a guide to that, then you can come and look at the programs that I offer. But do trauma work, even if you don't think that you have had trauma, because trauma is actually a human experience. Everyone has had their body go into that trauma response and into that overwhelm. Another thing would be that whatever your body is telling you in terms of your health, like that is actually one way that your body is expressing trauma. And so to listen to your body and to realize the different ways in which it can talk to you. And please don't ignore your body when it tries to talk to you. And finally, what I would want to share is that the healing potential, I think, is limitless. Truly, we don't even know how much is possible yet for people to experience and to grow in their life when they start doing this work and see it as an ongoing journey for the rest of their life. Truly, the potential is limitless.
It is indeed. I subscribe to that. Where can people find out more about you and your work, Dr. Aimie?
Yeah, they can find me over at my website, traumahealingaccelerated.com. And I have a guide for them there that might be the most useful. It's a guide on steps to identify and heal trauma. And so if you are one like me that you look back at your life and you're like, I don't think that I've had trauma. Or maybe if you know that you've had trauma and want to see how can you identify, how can you see the ways in which it's expressing in your body, then I have a quiz inside that guide on the steps to identify and heal trauma. And so they can find that guide on my website, traumahealingaccelerated.com.
That's great. Thank you so much, Dr. Aimie. It's been an absolute pleasure to talk to you and explore trauma from a very different perspective, very comprehensive and clear and concise. Thank you so much for everything you're giving to us here in this space and to the world. Many, many thanks.
Thank you. Thank you.